This 29-year-old woman was diagnosed with HIV and tuberculosis in July. She says prior to her diagnosis at a Durban clinic, she had little knowledge about TB. She went to the clinic for tests after showing worrying symptoms of insistent coughing, profuse sweating at night, and chest pains. Her first visit to the clinic is still vivid in her mind.
I went to a clinic and I asked them to test me for everything, which they did. It was Wednesday, if I remember correctly. They tested me for both HIV and TB. They gave me my HIV positive results on the same day, and I was told to return on Friday for the TB results. On Friday, the results confirmed that I have TB as well.
The young woman says she broke the news of her illness to her family and close friends who have been supportive of her. She says she's been put under strict TB medication for the next 2 years.
The medication was very harsh at first with the side effects. My feet and hands were painful and often swollen, but eventually it got better. It took me about 3 weeks to get used to the medication.
Experts say TB remains the #1 killer in poor communities. That's despite the many scientific advances.
In the world, we have approximately 10 million new TB infections notified every year. Every year, 10 million. And this has been going on for decades. In South Africa, in 2020, we had an estimated 328,000 new TB infections, among which about 60% were infected with HIV.
Professor Naidu says the COVID-19 pandemic also took the focus away from tuberculosis.
The amount of people coming forward to seek a diagnosis has dropped by about 48%. So we're not finding people with TB. They're walking around in the community. They are dying with TB without even accessing a diagnosis or any treatment. So yes, we have test and treat for HIV. It's an established strategy. In 2013, our government introduced a very accurate test that can produce a result within 90 minutes for the diagnosis of TB. But unfortunately, unlike HIV, which you can test at the bedside, make a decision and immediately start treatment, this test for TB has to be located in a centralized laboratory.
Professor Naidu will join other experts in this field at the 7th South African TB conference from Tuesday to Friday next week. The conference will be a platform for different stakeholders to engage and share knowledge on strategies to rejuvenate the fight against TB. Bongani Gema, SABC News, Durban.